Hi, everyone. My name is Dr. Kristen Lindgren, and welcome back to the podcast. If I didn't catch you last week, I hope you all had a wonderful holiday season with family and friends. There's always sad stuff and weird crap around the holidays. So, in spite of the good things, I'm always glad when December 31st is behind me, except for the fact that here in Wisconsin, we have a solid 4 months left of winter, and the sun shows up occasionally at best. The past few weeks, any potential sunshine seems to be largely masked by this strange fog situation. Have you seen this? Hopefully they're not spraying us with bird flu or some geopolitically engineered chemicals. I'm sure it's just some atmospheric nothingness, unrelated to anyone having walking pneumonia. I digress. The usual oppressive darkness got me thinking about today's topic, vitamin D. If that sounds interesting to you, then grab your headphones and let's go. Most people think about vitamin D as a vitamin or nutrient that you need for your bones or something. But it's important for way more than you think. Way. It's actually a hormone or a wonder drug, depending on who you ask. You can find it in pretty much any grocery store or Walgreens. Vitamin D influences everything from your immune system and your heart health to your mood. It regulates gene expression and has receptors on pretty much every single organ system in the body. I can all but guarantee this is something most Americans would benefit from taking. But this commentary is not meant to be medical advice. I'm just a crazy doctor with cows and chickens who talks to herself when her kids aren't home. The fact is, vitamin D is something most of us don't get enough of, even though it's free from the sun. Because you need to work and won't be seeing daylight until vacation or summer. Maybe. Today we're talking about the fascinating and I think poorly appreciated world of vitamin D. Most doctors don't know a fraction of this because they weren't taught anything about it in medical school. I know this because I went to medical school, actual pharma-trained medical school. Let's look at some data on what vitamin D is, how it works, and why it's critical for optimal health. We'll also talk about how to supplement effectively, if that's something recommended by your doctor, including the role of its essential cofactors like vitamin K2, magnesium, and more. We'll even look at how so-called high-dose supplementation, done with proper supervision and cofactors, is where we see the sunshine vitamin, well, really shine. Let's get into it. I think you could ask just about anyone these days why vitamin D is important, and they'd be able to come up with bones. Something about kids back in the olden days who never went outside for recess getting this soft, squishy bone situation called rickets. In Old English, the word ricken meant to bend or twist. Some people think the name came from there, but no one's for sure. Apparently, these kids' diets were really bad. Could they actually be worse than what they are now? And the air pollution so crappy that they never saw the light of day. Vitamin D is necessary to absorb calcium and keep bones strong, so some of these unfortunate littles ended up with twisty-looking bones that someone called rickets, and the name stuck. Regulations for air pollution were put into place, allegedly. Just saying, this is what it looks like from my window. We cleaned up the school lunch program, barely. Thank you, Michelle Obama. Fortified dairy products with vitamin D, and rickets thankfully went away. Kids' bones are still growing, so you could see rickets with your eyes. The lack of vitamin D made their bones grow all funny. Grown-ups end up with bone problems from insufficient levels of vitamin D too, but it's something you can't see without an X-ray or a DEXA scan. We just call it something different. Anyone know? You got it. In adults, we call this soft bone situation osteoporosis. What is vitamin D? Vitamin D is often referred to as the sunshine vitamin because our bodies make it when our skin is exposed to sunlight. That's not the only way we get it, but it's one of them. But vitamin D isn't actually a vitamin, it's a hormone. This means it runs around telling different parts of your body what to do. These messages help regulate everything from your mood and energy levels to your appetite, sleep, and how your body grows and heals. This vitamin D hormone is a critically important one, and not just for your bones. Its biggest job is regulating your immune system function. Did you know that there are receptors for vitamin D on every single one of your white blood cells? If those guys aren't being signaled appropriately, all sorts of scary things happen. The obvious one post-2020 is infections. There was that big infection situation that started around 2020 or the summer of 2019, depending on who you ask. You remember this. That's probably when vitamin D hit the zeitgeist. People like me and people with big platforms were talking about vitamin D. Lots of talk about vitamin D. We now know unequivocally that people with low vitamin D levels are more likely to get infected, and not just with COVID, with any sort of pathogen. Post-pandemic, we know that vitamin D deficiency was one of the biggest predictors of morbidity and mortality related to COVID. More on this in a minute. Your immune system has a bunch of jobs to do. It's supposed to prevent you from getting sick, but it's also supposed to protect you from getting cancer. What do you think cancer rates and cancer outcomes are in folks who are vitamin D deficient versus folks who are vitamin D replete? Your immune system isn't supposed to be a jerk. Your kids are supposed to pick on one another. That's normal. Your immune system is supposed to be a grown-up. When your immune system starts to pick on, well, you, we call that autoimmune disease. Hashimoto's, fibromyalgia, multiple sclerosis, rheumatoid arthritis, type 1 diabetes, inflammatory bowel disease. These are all examples of someone's immune system being a jerk. Instead of protecting them from illness, they're the ones causing the problems. We call autoimmune disease by a whole bunch of different names based on the organ system being bullied, but they're all really the same thing: immune system gone off the rails. Vitamin D is an immunomodulatory hormone. Modulation of the immune system is exactly what it sounds like. If your immune system is slacking, vitamin D kicks it in the butt. If it is freaking out and causing a drunken ruckus, like in the case of autoimmune disease or, say, a cytokine storm, it helps cool it off. Vitamin D does a few other things too. Immune function. Vitamin D helps your body fight off virtually all infections. I don't want to make this about COVID, but Lord, the data that poured in on this topic in the past several years is, well, definitive. People with low vitamin D are more likely to get COVID, be hospitalized with COVID, and die from COVID. Where were the public health recommendations on taking vitamin D to prevent COVID? Right? There weren't any. There weren't any then. There aren't any now. Still, many published studies confirm that a person's risk of getting COVID was 60% less if they had adequate levels of vitamin D, and the risk of death from COVID was essentially zero if your serum level of vitamin D was 50 nanograms per milliliter, a pretty mediocre level in my opinion. Vitamin D also regulates the inflammatory arms of the immune system, which are crucial in preventing autoimmune disease and cancer. Just a few studies here supporting that, in case you're wanting to, do your own research. It's called reading. Bone and muscle health. Without enough vitamin D, calcium can't be absorbed properly, leading to weaker bones and an increased risk for fractures. We call mildly weak bones osteomalacia and really weak bones osteoporosis. Why do you care about this? In simplest terms, osteoporosis-related fractures are associated with an increased risk of death. You care about that, right? I know you do. Strong bones are good. Period. Vitamin D deficiency also causes muscle weakness. Weak muscles also increase risk for falls and fractures. Bad stuff. Stay away from that. Cardiovascular health. Optimal levels of vitamin D have been shown to lower blood pressure and reduce the risk of heart disease. Why? Because vitamin D reduces inflammation, oxidative stress, and blood pressure while enhancing glucose and lipid metabolism. Mood and brain health. Low levels of vitamin D are linked to depression, anxiety, brain fog, and cognitive decline because vitamin D decreases neuroinflammation. Studies indicate that at serum levels higher than 50 nanomoles per liter, vitamin D alleviated symptoms of depression in patients with depression. In this study here. Metabolic health. Vitamin D improves insulin sensitivity and has been shown to lower the risk of developing type 2 diabetes, and not in a small way. In this study, just increasing vitamin D levels above 50 nanograms per milliliter reduced a person's risk of developing diabetes by 76% if they already had prediabetes, and 18% overall in the general population. Not metformin, vitamin D, people. Gut health. Vitamin D has been shown to regulate gastrointestinal inflammation and improve the health of the gut microbiome. Individuals with higher serum levels of vitamin D have lower incidence of inflammatory bowel disease, particularly Crohn's disease. Well, that would be an easy fix. So, given how important vitamin D is to basically every organ system and disease prevention system in the body, it should be clear why there are no recommendations for checking it or taking it from our health authorities. Costs $1, right? Okay. How do I know if I need vitamin D? How do you know if you have enough? Well, just check your labs. I'm sure it's right there next to your fasting lipid panel drawn by your primary care provider every year, isn't it? Go check. Not there? Not surprised. This is where our conventional system really drops the ball, and I mean really drops it. There are absolutely no guidelines for recommending for the regular surveillance of vitamin D levels in the general population. And I don't mean yearly surveillance, I mean never. Most regular physicians will absolutely not run vitamin D levels because there aren't any codes accepted by insurance companies just to check on it. Every time you submit a claim to your insurance company for a visit to the doctor, an imaging study, or a lab, it needs to be submitted with something called an ICD-10 code. The ICD-10 code provides medical justification to your insurance company for them to fork over the dollars to pay for whatever medical intervention is done or is being ordered. After you hit your $10,000 deductible, of course. Until then, you're paying for what? Well, all of it. I looked this up again yesterday. Most insurance companies follow Medicare rules and guidelines when it comes to medical justification. Not all, but most. Medicare publishes codes deemed medically necessary for justifying checking someone's vitamin D level. Spoiler alert, just to check on it, not on the list.
Child been involved in a violent altercation with a drunken and/or mentally ill member of his immediate family.
No.
Has he been involved in a household accident?
I don't know. I hope not.
Has the child ingested any poison and/or any other object that has become lodged in his throat?
No, he's just home alone. And I would like somebody to go over to the house and see that he's all right, just to check on him.
You want us to go to your house just to check on him?
Yes!
What is on the list? Well, let's see. Rickets, osteoporosis, osteopenia, osteomalacia. These are all about the same things, like soft, shitty bones that break and bow easily. Kidney stones, hyperparathyroidism, too much vitamin D in the blood, and too little vitamin D in the blood. That's basically the medically justified reasons for checking someone's vitamin D level. I'm not sure how you would know if you had too little vitamin D in the blood without checking the blood for vitamin D. Any ideas? It's curious. And I'm not sure what the point of waiting until you're diagnosed with osteoporosis from a hip fracture is and then checking your vitamin D level. You can't just be like, whoops, I guess low vitamin D caused your osteoporosis, so we're just going to give that back to you. That's not how this works. Once bone is gone, the $1 vitamin D pill doesn't magically bring it back. It's maintaining adequate levels over the totality of your adulthood that prevents it from happening in the first place. Here at LFM, we routinely check vitamin D levels in all of our patients, the whole test, not guess philosophy. The cash price on this is well under $100, just to check on it. If you know what your level is, that gives you a pretty good starting point on knowing how much to take. Different variables impact how much each person will likely need. For example, older people and folks with malabsorptive issues like celiac disease typically need higher doses because they don't absorb vitamin D as well. People with higher body fat content typically need higher doses than people with lower body fat content because vitamin D is what we call a fat-soluble vitamin. This means that if there's more body fat around, the vitamin D will have a tendency to go hang out there, leaving less available in the blood. People with darker colored skin and people who live at higher latitudes typically need more vitamin D. Dark colored skin typically absorbs less vitamin D from the sun than light colored skin does. And those of us living above the 37th latitude never see any naturally occurring ultraviolet rays ever. See that line right there? Most of us are living in the danger zone. What is an optimal vitamin D level? Great question. answer is unfortunately not in the infamous reference range. I'm always railing on about reference ranges. Remember, reference ranges vary from lab to lab. These are ridiculous. Here, according to Mayo, less than 10 nanograms per milliliter is too low, but greater than 80 is toxic. Health Match says that less than 20 nanograms per milliliter is too low, but 30 is perfect. Rupa says 20 to 40 is the standard reference range, but 40 to 70 is optimal. And watch for units here. Here in the US, we use nanograms per milliliter to measure vitamin D levels. In Europe, they use nanomoles per liter. So make sure when you're sleuthing this out later on that you're looking at the right units. I'm using nanograms per milliliter. Generally speaking, the reference range is determined by the lab. It is a statistical average of the results of the labs they got from the people that went there. If the population the lab is measuring is, people who are more likely to be vitamin D deficient, what are the results even telling us? It's giving us a reference range for vitamin D deficiency. So in my opinion, these numbers are basically useless unless we're looking to prevent acute illness. Functional medicine is in the business of preventing illness. Two totally different paradigms. Based on the science referenced all over the place here, it seems like the optimal level of vitamin D is in the greater than 50 nanograms per milliliter range. I'm not giving medical advice here, just reading some research papers. The metabolism of vitamin D. There are two main forms of vitamin D. Vitamin D2, or ergocalciferol, which is usually plant-based or synthetic, and vitamin D3, or cholecalciferol, which is animal-based and more effective at raising blood levels. Natural food sources of vitamin D3 include fatty fish like salmon and mackerel, everyone's favorite, cod liver oil, and egg yolks. Not milk. There's only vitamin D in milk because we put it there. But let's be honest, most of us probably aren't drinking milk or eating enough of these foods to meet our needs. I actually caught this mackerel on vacation and was so proud of myself, and this freaking barracuda ate half of it before I could get it in the boat. Apparently, barracuda need vitamin D too. Who knew? And then, of course, you get vitamin D from the sun. That's if you happen to live somewhere that actually sees the sun. Through a process longer than you care me to ramble on about, ultraviolet B, or UVB rays from the sun convert a type of cholesterol in the skin into vitamin D. Reason number 837 why you need cholesterol. And then it heads to the liver for its first step of activation, and then to the kidneys for its second step of activation. And then we're off to the races. I made this graph. Isn't it pretty? I'm getting better at Canva. Yes, but the words, there's so many words. And the different words for the same thing. Here's the high points of the vitamin D metabolism in the plainest English I can muster. Vitamin D3 from the sun, supplements or food, is called cholecalciferol in doctor talk. Doctors and scientists need to make themselves feel smart by creating this whole other language. Sorry, hang in there with me. Vitamin D2 is a thing. But like I said, don't take that. It's not stable and not well absorbed. D3 only. Vitamin D heads to the liver to become 25-hydroxyvitamin D, also called calcidiol or calcifediol. This is the name of the prescription form. Then it heads to the kidneys to become 1,25-hydroxyvitamin D, also called calcitriol. When you get a blood test, and again, good luck, you're most likely getting a 25-hydroxyvitamin D level. This is also referred to as 25-OHD, calcidiol, and calcifediol, just to confuse everyone. Anyway, they check 25-hydroxy-D because this is the main storage form in the body. It can take a couple of days to a couple of weeks to fully activate vitamin D from D3 all the way to 1,25-hydroxyvitamin D, which is why if you take a sick person in the hospital and give them a bunch of regular vitamin D3 from a bottle, it's probably not going to be very effective. Again, I'm not giving medical advice here, but hypothesizing that you'd be further ahead to give calcidiol or calcitriol, cut the line a bit and get some activated vitamin D on board. Just a thought. What are common symptoms of low vitamin D? I'm not talking Rickets level of deficiency here. I'm talking about below the optimal range here. Vitamin D deficiency can present with a range of symptoms, many of which are subtle and easily overlooked. Common symptoms include bone pain, aching, tenderness, often in the low back, hips, legs, or ribs. Muscle weakness, increased risk for fractures, fatigue and low energy, mood changes like depression or seasonal affective disorder, frequent colds or infections, poor wound healing, hair loss, dental issues, muscle cramps and twitching, neurological symptoms like cognitive difficulties or brain fog, increased risk for anxiety. What diseases are associated with low vitamin D? Okay, these sound a little scary, but remember, maintaining adequate levels of vitamin D basically costs nothing, like pennies a day. Insufficient levels of vitamin D are linked to a variety of diseases and health conditions. These associations stem from vitamin D's role in calcium metabolism, immune regulation, and its effects on nearly every single solitary system in the body. Bone and skeletal disorders, osteoporosis, osteomalacia, rickets, immune-related conditions like autoimmune disease, multiple sclerosis, type 1 diabetes, rheumatoid arthritis, frequent infections. Low levels are linked to increased susceptibility to respiratory infections, including colds, COVID-19, and probably bird flu. Cardiovascular disease like hypertension and heart disease, metabolic disorders like type 1 diabetes, metabolic syndrome, neurological and psychological disorders like depression, cognitive decline, and dementia, cancer. There are strong links with colon, breast, and prostate cancer. Low vitamin D levels are linked to high risks of developing these cancers, and deficiency may affect prognosis. Chronic pain and fatigue, like fibromyalgia and chronic fatigue syndrome, respiratory and infectious diseases like COPD and COVID-19, pregnancy-related conditions like gestational diabetes, preeclampsia, and infertility, skin and hair disorders like psoriasis and alopecia, and then other chronic conditions like chronic kidney disease and non-alcoholic fatty liver disease. It's quite a list. It makes a person wonder just how much disease and despair would vanish if everyone just had adequate levels of vitamin D. How much vitamin D should I take? The amount that you as an individual need depends 100% on your individual body. Your age, skin color, body fat composition, diet, medications you may be taking, genetics, gut function, where you live, how much time you spend outside, how much clothing you wear when you go out, all play a role. How much and how often a person needs or takes vitamin D needs to be tailored to that unique individual and then monitored with labs. Having said that, I'm a medical doctor, but I may not be your medical doctor. I am not recommending or giving medical advice. I'm just reviewing the science here. In the US, the recommended daily allowance, or RDA, for vitamin D is 400 international units daily. Vitamin D is usually measured in international units, but sometimes you'll see it in micrograms. I'll be referring to vitamin D in units, not micrograms. Who measures things in micrograms? What is a microgram? The average person's body uses somewhere in the arena of 10,000 to 25,000 units of vitamin D a day. Well, that's what's made by your skin from sun exposure if you happen to be outside and don't have access to sunscreen. How the government came up with all you need to take is 400 units a day, I'll leave up to your tinfoil hat wearing imagination. Okay, I won't. I'll just tell you. The RDA, or minimal dietary allowance numbers, were determined eons ago as the bare minimum amount of a nutrient to prevent an acute disease. These guidelines were created back in the 1940s during the Second World War. There were concerns about food shortages and nutritional deficiencies, so the government put these together to say, hey, you may be starving to death, but make sure you're getting at least this measly amount of whatever nutrient they were referencing. RDA numbers are basically the bare minimum amount of something you need to take to keep from dying. These are not in any way, shape, or form numbers linked to optimal health. Again, not giving any medical advice here, but based on the studies referenced in this post, optimal daily vitamin D intake appears to be about 10 times the RDA, somewhere in the arena of 2,000 to 10,000 units daily. Having said that, there's nothing shy of absolute hysteria from the conventional medical system around taking too much vitamin D. So, what are the risks of taking too much vitamin D? This is almost a theoretical question because I've never seen it. But the concern about taking too much vitamin D is something called hypercalcemia, which means too much calcium in the blood. Remember, you need vitamin D to absorb calcium from your diet. And if you're taking boatloads of vitamin D, the concern is that you may absorb too much calcium from your diet. Too much calcium, and too little calcium for that matter, are very bad. We don't want either of those things to happen. You'd be surprised at the amount of calcium in your diet. If you eat any cheese or, vegetables, there's actually quite a bit running through that freeway we call your digestive tract. But your body is really smart about calcium regulation. The system has to be really off balance for you to override it with diet or supplementation. But it can happen. My patients love vitamin D. They take a ton of it, and we've never seen a single solitary case of high calcium related to vitamin D supplementation. Never. But vitamin D does use some cofactors in order to use its job. So if a person would be taking larger doses, somewhere in the arena of 2,000 to 10,000 units daily, it would be advisable to take it with these cofactors. Vitamin D needs vitamin K2, magnesium, and if we're getting technical, some zinc, boron, and vitamin A in order to do its best job. Vitamin K2 is by far the most important cofactor. I'm already way lost in the weeds here, so I'm going to leave it at that. D3 should be taken with K2. Got me? Okay. But let's say you're being sassy. How much vitamin D would a person need to take without taking any vitamin K2 to cause hypercalcemia? Well, I'm glad you asked. I tried to find the answer. Back to established vitamin D numbers. Body makes up to 25,000 units daily, again when there's sunshine. 3-letter agencies recommend 400 units daily. Back in the 1930s and 40s, vitamin D became known for its immune system benefits. Apparently, with enough sunshine, you could cure tuberculosis, like the worst, most antibiotic-resistant infection ever. Because of this, researchers got maybe a little too excited about high doses, or misplaced a decimal point, I'm not sure. There's a study, this one, where the researchers studied vitamin D supplementation for the treatment of all things immune system function related. So like autoimmune disease, infections, cancer, and they did so in high doses. And I mean really high doses. Doses ranging from 60,000 to 300,000 international units daily. Ooh, fun. For reference, I personally take 10,000 international units daily with 120 micrograms of K2, which is neither here nor there. And I think that's a pretty aggressive dose. Okay, so these researchers found that at these crazy high doses, they could cure tuberculosis, control asthma, and ameliorate symptoms of rheumatoid arthritis. And even though these doses are about an order of magnitude higher than I would consider necessary to accomplish this goal, these people had absolutely no symptoms or toxicity from hypercalcemia. Another similar study was published looking at, more reasonable doses, daily dosing with vitamin D3 from 5,000 units daily to 50,000 units daily. Still quite generous, but an order of magnitude less than the previous study. What did they find? No cases of hypercalcemia were observed using these doses for up to 7 years. The highest blood level attained on 10,000 units of vitamin D daily was 202 nanograms per ml. Mean vitamin D levels on 10,000 units daily were 96 nanograms per ml and 116 nanograms per ml in 2 different data sets. Cases of asthma and psoriasis were completely controlled with 25,000 units daily and 50,000 units daily, respectively. The bottom line, for dosage, for most adults, 2,000 to 5,000 units of D3 per day is a safe and effective range, but individual needs may vary. High-dose strategies should be undertaken with medical supervision, meaning have your labs checked. And if your doctor won't order it, come talk to me. Timing. Take vitamin D with a meal containing fat for better absorption. Remember, fat-soluble vitamin. Take it in the morning. Nature gives you sunshine during the day, not at night. We're already hitting nightfall here, folks. It's like 2 p.m. Combination. Pair your vitamin D with a high-quality vitamin K2 supplement and magnesium, zinc, boron, and A if you're being fancy. The average dose on this is 100 to 200 micrograms per day. Testing. I personally would aim for blood levels in the range of, well, greater than 50 nanograms per mil if you want to prevent diabetes or infections or cancer. I actually like to see that number closer to 100, and we have studies that show that even upwards of 200 appears to be safe and not associated with hypercalcemia. But I can't say that levels that high provide any benefit above and beyond that which is seen in the 50 to 100 range. Conclusion. Whew, sorry, this was a long one. To wrap up, vitamin D is more than just a nutrient. It's an extremely important hormone that impacts every system in your body. If everyone had optimal levels of vitamin D, it makes you wonder what would happen to the incidence of autoimmune disease, cancer, serious infections, and depression. It's interesting that most of the data we have is privately funded and done outside the US. Eisenhower famously said, "If you make war profitable, you'll always have war." It's clear to me we've done the same with healthcare. By making illness profitable with expensive pharmaceuticals and other medical interventions, well, there's really no incentive to make people healthy, is there? Vitamin D isn't a drug. It can't be patented. It costs a few dollars, and so I suspect it will stay relegated to the shelf of dangerous pseudoscience. Thankfully, you all know how to read. From immune function to bone health and beyond, we know that getting enough vitamin D is an absolute game changer for your health. Hopefully that information brings some sunshine to your life, even if it needs to be in a supplement form. That will do it for me. Thanks for listening, everyone. If you found this information useful or entertaining, please like the channel, subscribe, and share the video. Those things are lame to ask for, but they really help us out. Until next time, stay frosty, keep learning, and remember, you are absolutely in control of your own healthcare. We'll see you for the next one. Bye for now.